Hi, welcome to Eduvis Academy's YouTube channel. Eduvis Academy is providing classes for nurses who are preparing for licensing exams like Prometric, Haad and DHA. It's an online application program. It includes theory classes, exam-based theory classes, which is a 35 hours online class. In addition to that, we have questions, question discussions, mock test and exam mode practice test. So basically one of the most important feature of our app is that you can watch the classes at your own convenient time. So with all these facilities, we can assure you that you can clear your exams easily. Okay, so let's start our question discussion session. And before starting that, one more thing we would like to remember you. If you like this video, please like, share and subscribe. Okay, so let's start the question discussion. Hi, let's see the first question. Both parents have sickle cell anemia trait. The percentage for the child to have the disease. So here the question is about sickle cell anemia. Both parents have sickle cell anemia trait. The percentage for the child to have the disease is, options are A 100%, B 50%, C 75% and D 25%. So sickle cell anemia is a chromosomal abnormality in which the RBC becomes sickle shaped due to the abnormal hemoglobin, which is HbS. So it's a chromosomal abnormality in which the RBC becomes sickle shaped and it leads to the destruction of RBC, and this destructed RBC and the sickle shaped RBC will cause obstruction to the blood circulation, causing severe pain, hypoxia and dehydration. So this is sickle cell anemia, and as it is a chromosomal abnormality, the chances of getting the disease to their children are high. So the criteria for getting the sickle cell anemia for their children is that if both parents are carriers. Carriers means, in other words, sickle cell anemia trait. Carriers means the abnormal chromosome will be present in their body, but they don't show any symptoms. Those are called as sickle cell anemia trait. So if both parents are carriers, the chances of getting sickle cell anemia for their children is 25%. Okay, and if one of the parent have the disease and the other is a carrier, then the chance is 50%. And if both parents have sickle cell anemia, the chances are 100%. So here in the question it's mentioned that both parents have sickle cell anemia trait, which means both parents are carriers, and hence the percentage of the chances to get their child is 25%. Okay, now let's see the next question. When the nurse put the baby with high temperature into cold water, the baby will lose the temperature through which process? So these are the modes of heat transfers. Option A evaporation, B conduction, C convection and D radiation. So when the baby with high temperature is put into a cold water, what type of heat loss occurs? This is the question. Okay, so when the high temperature body is immersed into a water, when our body come into contact with a liquid, the mode of heat transfer which occurs is known as evaporation. When fluid comes in contact into our body, the heat from our body is lost through vapor, which is known as evaporation. So here answer is A evaporation. Conduction means when our body comes into contact with a cold solid object, then the heat loss occurs is known as conduction. For example, ice application. Okay, you see, if you apply cold pack to a body, why do we feel cold? Is that because the heat is lost to that solid cold object, which is known as conduction. Another example is that when a newborn is placed in a weighing machine, at that time also the heat loss occurs is through conduction. So when a body comes into contact with a liquid, the heat loss occurred is known as evaporation, and when the body is come into contact with a solid cool object, which is known as conduction. Okay, and third is convection. Convection means the heat from the body surface is lost. It flows from our body to a cold solid object without contact. So here there is no contact between the cold solid object and the body, but the heat from our body is flown to the cold solid object, which is known as convection. An example is AC room or a room with a fan. So at that time, the heat loss occurs is through convection. And radiation, here the heat loss is through radiation. Here also there will not be any contact with the body. The heat loss which occurs through radiation is known as just radiation. For example, phototherapy. In phototherapy, the heat loss occurs is by radiation. Next question, which hormone is responsible for uterine wall change and breast enlargement during pregnancy, leukorrhea and hyperemesis? Which of the following placental hormone is responsible? So, the question is, which of the following placental hormone is responsible for uterine wall change, breast enlargement, leukorrhea and hyperemesis gravidarum? Options are A. Progesterone, B. Estrogen, C. HCG and D. TSH, which is thyroid stimulating hormone. HCG is human chorionic gonadotropin. So, the hormone which helps, or the hormone which is responsible for all these uterine wall change, breast enlargement, leukorrhea and hyperemesis gravidarum is estrogen. Actually, estrogen is directly not linked, but in hyperemesis gravidarum, the levels of estrogen in the body is increased. The actual hormone responsible for hyperemesis gravidarum is HCG, but for all these things, uterine wall change, breast enlargement, leukorrhea and hyperemesis is connected to the estrogen. Okay, leukorrhea is a white discharge seen due to vaginal infection, vaginitis. It may be due to fungal infection by Candida albicans or sexually transmitted diseases like Trichomonas vaginalis. So, in that case, there will be a white discharge produced from the vagina, which is known as leukorrhea, and the hormone responsible for that is estrogen. Okay. So, here answer is option B, estrogen. Next question, nurse manager pull out or float the nurse from medical ward to CCU. Which of the following patients should be assigned to the nurse? A. Patient just transferred from cardiac catheterization. B. Patient just received with unstable angina on heparin infusion. C. Patient need discharge education about coronary stenting. And D. Patient on Lasix IV have acute left ventricular failure. So, here a nurse manager shifts or floats a nurse from medical ward to the CCU, cardiac care unit. So, what responsibility should be assigned to that nurse? That is the question. So, one thing we have to remember is that a nurse from another department is being floated to CCU. So, basically she is a new nurse and she is having a new environment. So, suddenly we should not give such responsibilities that is of high risk or which is not familiar with her department. Okay. And for a new nurse, what we do is that you should give the work which is not that much hard or work which requires less risk. So, if you see the options, patient just transferred from cardiac catheterization. So, for that an experienced staff is necessary. So does patient received with unstable angina on heparin infusion. Okay, continuous monitoring is required and the staff should be aware of the condition and she should be experienced with that department. C. Patient need discharge teaching about coronary stenting. So, in order to give discharge education for a patient, the staff nurse should be aware of the entire patient condition right from the admission till the discharge, which is not possible for a new nurse who is being floated. And option D, patient on Lasix IV who have acute left ventricular failure. So, here patient is on Lasix IV, patient with left ventricular failure is having Lasix IV. So, the only thing the staff nurse has to do is to observe the patient and to monitor the urine intake output. So, out of these four options, option D is suitable for a new nurse who is being shifted from the another department. So, answer is D, patient on Lasix IV with acute left ventricular failure. Next question, the nurse is caring for a client who has had a right modified radical mastectomy this morning. Which exercise should the nurse encourage the client to perform this evening? So, here patient has undergone right sided radical mastectomy this morning. Question is that which exercise should the nurse ask the patient to do this evening? So it's been less than 24 hours. So we cannot ask the patient to do heavy exercises, because we can do exercises only after the wound is properly healed and the stitch is removed. Alright. So here options are hair combing exercise with the right arm, wall climbing exercises with the right arm, movement of the fingers and wrists of the right arm. D is passive range of motion exercises. So out of these four, passive range of motion exercises means patient will not be able to do, and someone else is providing the exercises for the patient. It is known as passive range of motion exercises, which is commonly done in patients with paralysis, quadriplegia or spinal cord injury. So here passive range of motion exercise is not required. And if you see the three options, as I said in the beginning, we cannot ask the patient to perform much stressful exercises, because surgery has been done in this morning, and so the patient cannot do large exercises. So hair combing exercise with the right arm, wall climbing exercise requires much pressure. So here the wound is not healed and the stitch is there in the place. So the most suitable exercises which the nurse can ask the patient to do is movement of fingers and wrists of the right arm. Right. First two exercises are post mastectomy exercises, but these two are done only when the wound is healed and the stitch is removed. So movement of the fingers and wrists of the right arm. Option C is the right answer.